Hello everyone, myself Dr. Vinayak Harale. I am an endocrinologist practicing at Supreme Clinic, Akurdi, Pune. Today I will be discussing one case that is poorly controlled diabetes with hypoglycemia risk. So one gentleman, 50-year-old male, is a known case of type 2 diabetes and he has history of frequent hypoglycemia events since last 2 months. And currently this patient is on metformin 1000 milligram BID and also is taking glimepiride 2 milligram BID dosages. And on investigation, his HbA1c was 8.2, EGFR 88, LDL 90, HDL 36, triglyceride 126, LFT normal, RFT normal. And on examination, his BMI 31, is obese, BP blood pressure is normal, and heart rate is also normal. So we all know that we have to optimize the glycemic control with cardiorenal protection, which is a very important primary treatment consideration in all our type 2 diabetic patient. And HbA1c goal for many non-pregnant adults should be less than 7%, except there are certain situations where we have to keep the HbA1c below 8%, like those who are elderly patients with end organ failure. And we all know that in 21st century, type 2 diabetes has reached epidemic proportionally globally, and Indians have tendency for earlier onset of type 2 diabetes. If you compare with the Caucasian, we have almost a decade earlier onset of type 2 diabetes, and also we are at higher risk of cardiovascular complication as against the Caucasian population. So there should be a strict glycemic control is very important in type 2 diabetes management, where we need to keep fasting plasma glucose below 130, PP below 180, and HbA1c below 7%. But while doing this, we have to be very careful that our patient should not suffer from any type of hypoglycemia, whether it is mild, moderate, or even unrecognized hypoglycemia. And sulfonylurea plays a very important role in a glycemic control. It's a molecule that we are using since many decades, and it's a direct the action of sulfonylurea. We all know that it increases the insulin secretion in the blood, and there is a highest risk of having hypoglycemia among all the oral anti-diabetic agents. And the risk of hypoglycemia increases the cardiovascular as well as the renal risk factors also increase with the hypoglycemia. And it's a major concern for the users of hypoglycemia. Also, the magnitude and the severity of the sulfonylurea-induced hypoglycemia, it ranges widely across the studies. Therefore, it comes into the picture that we should use the molecule which are cardiorenal safe, and also at the same time there would be lesser risk of hypoglycemia. So here is the picture of DP4 inhibitor and SGLT2 inhibitor comes. There is a strong rationale for the combination of these two molecules, that is DP4 inhibitor and SGLT2 inhibitor in patients with type 2 diabetes, because these two drugs exert a different and complementary glucose lowering effects. Furthermore, the increase in the glucagon level, which is induced by SGLT2 inhibitor, may be blunted by the co-administration of the DP4 inhibitor. And also the clinical evidence shows that this combination is very much effective option for the management of type 2 diabetes, which provides the very good HbA1c reduction, which ranges from 1.1 to 1.5. I have seen the HbA1c reduction up to 1.8%, particularly those patients with the higher baseline HbA1c. And also there is a weight reduction which happens approximately 2 kgs when it is added to the metformin, which is a primary place in the therapy. Also, the American Diabetic Association recommends the initial combination therapy whenever there is a baseline presenting HbA1c is 1.5% above the target. So the target is above, suppose 7, then that if the HbA1c is above 1.5, that is above 8.5, then it's completely rational to use this combination of DP4 inhibitor and SGLT2 inhibitor. And this unique combination also lends itself readily to early treatment intensification, because there is a good tolerability, low risk of hypoglycemia, and possible weight loss mechanism, and also minimal treatment burden. So in one pill, patient able to achieve the good glycemic control, plus this additional cardiorenal advantages are there with this molecule. And also there is a lesser risk of the genitourinary infection when this combination is given. Unless we give the separate SGLT2 inhibitor, there would be higher risk of the genitourinary infection, but in the combination, these chances are also less. So the clinical experience with DP4 inhibitor and SGLT2 inhibitor combination, it shows that they can be used with a good safety profile and low risk of the adverse event like hypoglycemia and weight gain, which was there with the sulfonylurea in our patient. So also I mentioned that there is a reduction in the incidence of the genital infection associated with the SGLT2 inhibitor has been reported when the D4 inhibitors are added, perhaps because the better glucose control, although other possible mechanisms remains to be investigated. Thank you very much for your patient listening.